We're joined now by Dr. Jamie Taweel. He's an internal medicine specialist at Grand River Medical Associates. Dr. Taweel, thank you for being with us again.
Thank you for having me. How you guys doing?
Doing all right. How are you, and how's your team at the practice?
You've been busy,
Yeah,
as always.
to say the least. So we've seen a bit of a spike in COVID cases in recent weeks, and it's concerning a lot of people, with younger people being the majority of these new cases. Should the spikes still be a concern, or is this spike a result of more testing, and we maybe should feel more optimistic because of the smaller hospitalization and death toll numbers?
So it's multifactorial. There's different reasons for it. I think a little bit of opening up of Michigan, that we're starting to relax things a little bit, that caused a bit of an uptick in cases. I think the other concern is that the testing has gotten better. We're also doing a lot more antibody testing to see people that have been exposed in the past. So we might be getting some of those numbers that were positive previously. We're now adding that to the pile, so to speak. And things like that. But it is creeping up. It was to be expected. It's still manageable, but at the same time, we want to make sure it's not rising too aggressively. That's always going to be a big concern.
Are there concerns within the medical systems at play that they may become overburdened again if this recent spike is not thwarted soon?
Oh, absolutely. Any medical systems, the reason we're doing all of this whole flattening the curve thing, is so that we can avoid overwhelming the hospital resources. So there's always going to be a bit of concern. I'm confident we will not get back to that point where we were completely running out of ventilators and, we were running out of personal protective equipment, things like that. I think it's starting, the lesson has been learned and people are starting to smooth out a little bit. However, that always can be a possibility. I hate to be doom and gloom all the time, but, as a medical professional, you want to make sure that we're not going to overwhelm the system. So it's a balancing act.
One of the major issues in the first wave of the COVID-19 pandemic in the early spring, when this was first getting started, was that hospitals were overburdened, as you mentioned, and they were having trouble getting PPE. We were competing between country to country. We were competing state to state in order to get hospital gowns that were fresh, masks, N95 masks, and other personal protective equipment for those on the front lines, and ventilators for hospitals on the front lines as well. In recent times, we've heard from various hospitals and in various articles that the stock of PPE is at a better place now than it was before, and that that the systems are in place that if there is a second wave, PPE stock may not be as major of a problem as it was during the first wave. With that being the case, and understanding what's going on in states like California and in Texas, definitely in Arizona and in Florida, if there were to be a similar situation arise in Michigan where we have this spike turn into a surge, can we survive a second wave? Are our hospitals going to be able to deal with that problem?
That's a tough question for me to answer, quite honestly, because I don't have the data with regards to what hospitals have on hand. I think that if we get another surge, we're going to get jammed up pretty quickly. That's just my personal opinion, is that it's going to be tough because you have to consider how often PPE gets used. If a patient comes to the emergency room, PPE for the patient, PPE for the physicians, the nursing staff, and then they have to recycle it with each patient. It has to keep on going. Any surgical procedures, anything, and it has to keep on going. I don't doubt that we could very potentially run out awfully quick, because it's something that became that is so necessary to prevent this surge from becoming another humongous surge. So the important thing is as hospitals, we got to try and conserve when things are going smooth as opposed to when things are going bananas. So when COVID initially surged, everybody was conserving PPE as best they can. And now that we're a little bit of a down, it's rising back up slowly, but we're not anywhere near where we were when it first started. The good news is that this is a time to also practice some conservation as well, so that when things do get a little bit more aggressive, hopefully not, but when they do, we're better able to prepare for that.
Dr. Jamie Taweel with us. He's an internal medicine specialist at Grand River Medical Associates. So we've seen some COVID-19 antibody medications recently reach phase 3 of their testing. Can you briefly explain how directly receiving these antibodies from a medication could help either prevent COVID-19 or help people that may contract the virus deal with the virus after they are infected?
Of course, the antibody is basically a signal for the body, is the method in which the body attacks the virus. So if we were to be able to create some sort of therapy to assist the body in using those antibodies to help combat the virus, it would be more beneficial for the patient. Essentially what happens is, just like if you were to get like a vaccine, the antibodies would build up into your system, your body would be better prepared and already addressing that virus, so to speak, to prevent it from happening again. So it would be a good thing. Hopefully that will be coming down the pipe awfully soon.
Are there any dangers that are presented with these antibody medications? Any cause for concern for some people that, I mean, there's side effects with any kind of medicine, Dr. Taweel, but in this case, are there any major concerns that these could have adverse effects on some people?
Certainly, it can always cause some sort of an allergic reaction. That's always going to be the big concern. The other big concern is that your body might, the antibodies kind of are the attack mode for the body for your body to basically combat this. And the only another concern could always be that your body would, mount an attack against other things. For example, autoimmune diseases where your body starts to attack itself, things like lupus, et cetera. So there's always a concern that could happen. Those risks obviously are going to be low, or else the drug would not be approved for widespread use. However, those possibilities do exist, specifically in more riskier patients for things like that.
Dr. Jamie Taweel with us, internal medicine specialist at Grand River Medical Associates on the Oakland County Megacast. Dr. Taweel, it's really freaking hot outside right now. It's horrible. I mean, Ronnie and I, you can't see us on the Zoom call, but both of us are wearing black today because we're just the daredevils of local news, I guess. How can folks remain cool during this heat wave, and what are some of the danger signs that some people need to be cautious of if they become overheated?
Oh, absolutely. All right. Of course. Obviously maintaining hydration is going to be your best bet to try and avoid getting overheated. Maintaining hydration is a big deal. Your body loses a significant amount of water as it begins to overheat. So as long as you are continuing to hydrate, you are really assisting yourself in preventing getting overheated. Don't exert yourself. Listen to your body. If you start to become short of breath, lightheaded, dizzy, things to that effect, headaches, those are signs. Get into a cooler area. Get yourself cooled down. Hydrate. So those are going to be the basic ones. But again, making sure that you're listening to your body. Try not to push. Oftentimes people get into trouble because they tend to downplay symptoms, and they go through them and they ignore them, and that can be a little aggressive, specifically in the heat. If you're working outside, if you're a runner, you are already losing a lot of water. And if you continue to do that in a heat, you're going to lose it a lot more significantly. So make sure you're hydrating, etc.
In the case that someone is feeling these adverse effects from the heat, they've been overexerting themselves outside, at what point should somebody be seeking medical help?
Whenever they're getting symptoms. So, when is it too hot? When it's too hot for you. So if you're starting to have an issue where you're not urinating as often as you typically do, or if you're, again, like I mentioned, headaches, dizziness, shortness of breath, lightheaded, any chest pressure or pain, those are signs you need to get evaluated relatively quickly. Drinking water alone at that point may not be enough. You might need to get it intravenously through the emergency room so that you can maintain hydration.
How deadly is it if people do not properly address these negative symptoms from heat and from exhaustion?
Well, it typically depends on whether or not you already have medical issues going on. So for example, if you were a cardiac patient, this could definitely strain the heart to such a degree. As you become overheated, your heart beats faster. It's like giving yourself almost a stress test. You could be putting yourself at risk for cardiac events. If you're a typical person that has no real medical history and you're starting to get overheated, you can start to cause a lot of problems with your kidneys. You can start to cause a lot of problems with the end organ damage, things to that effect. Muscle cramping and aches can cause muscle damage as well. If you're on particular medications, it can compound those things. Most importantly, just your kidneys and your hydration status, which are the big things that you want to avoid damaging first.
Dr. Jamie Taweel with us on the Oakland County Megacast. He is an internal medicine specialist at Grand River Medical Associates. Timing is everything in most cases, and definitely in emergency medical situations. If someone is feeling these symptoms, what is that critical window for them to go get treatment?
Well, that's a tough one. It's simply because sooner the better, obviously. The critical window, if you start to have symptoms, as soon as possible, within the hour or two, to make sure that it doesn't continue to progress. there's going to be a tipping point where if you're having problems, then it starts to compound on itself. For an example, if you are dehydrated significantly and you're getting overheated, you're getting breakdown into your muscles, your kidneys are causing damage. The breakdown products from those muscles actually can clog the kidneys and further compound that damage. So the quicker you get that resolved, the better it's going to be. And that's it's not this straight linear curve. It's more logarithmic. Once you hit that tipping point, things go dramatically worse, if that makes any sense.
I know that you deal with humans, but one time I went through this with my dog, and I remember thinking to put her in an ice bath. Does that work for humans as well?
Well, yeah, it definitely can help with cooling things down. Hydration, again, I'm always going to stress hydration, but maintaining a lower temperature, absolutely. As the temperatures do increase, you're gonna get some problems that are going to happen internally. And again, muscle breakdown, organ damage, things to that effect. So if you are finding yourself overheated, you are getting symptomatic, yeah, absolutely. Getting in an ice bath will help. Getting hydrated will help. Getting to the emergency room will help.
Recognition of these symptoms is absolutely key. And so with people outside, they're exercising, they're going for runs together, they're playing sports together, they're shopping together in outside settings, whatever it may be, or they're working out in their yards. For people that are either working with other people or hanging out with other people or are just observing other people as they're passing by, what are some of those symptoms they need to be looking for heat stroke and for heat exhaustion so that they can help other people that they're with or that they see get the help that they need?
Probably the most important thing that I would think would be the symptoms that don't go away rather immediately. You're going to get tired, you're going to get more fatigued, you're going to get a little bit dehydrated when you're outside doing those things. But typically, if you rest a couple minutes, things will get better. It's definitely a sign that you should go, seek cooler areas and things like that. And it definitely, continue hydration, continue to get cooler, and going in that direction. But if those symptoms don't go away when you're resting, then that can be something a little bit more dangerous. If you're getting lightheaded, you sit down or you lay down and it doesn't get any better. Or if you sit down or lay down and then you immediately get up and it returns, those are going to be problems. So anything that doesn't resolve rather immediately, and of course, anytime you're significantly short of breath or having chest pains or having blurred vision or, lightheadedness like you're going to pass out, and it doesn't go away rather immediately, that's a definite sign you should be contacting somebody or you should be seeking further help.
Dr. Jamie Taweel with us on the Oakland County MegaCast. Before we let you go today, Dr. Taweel, anything else that you'd like to touch on or any other important information for our audience to know?
Yes, I think I want to stress again the mask wearing. The question shouldn't be whether or not you wear a mask. The question should be, why isn't everybody wearing one? Specifically during these times, make sure that the mask is fitting appropriately. I'm seeing a lot of people that are getting the nose out for over the mask, and I understand that they are completely uncomfortable. I understand that they can make you feel claustrophobic, and I understand that they're dramatic. Someone had once said to me, if you don't like the mask, you're really not going to like the ventilator. And it's a little bit of an extreme argument, but at the same time, it could be a potential issue. Make sure that the mask is snug around the cheeks. It's not billowing out. Try not to use your hands to adjust the mask. Use the ear straps if possible. Other things, those masks that typically have a valve on them, those are pretty good masks to have. However, the problem with those valves are, more often than not, they protect you against air coming in, but they don't protect against air coming out. They're a one-way valve. So as you breathe out, it'll plume out your breath, and that can be an issue as well. So try to avoid those masks that have valves on them. And other than that, I think just keep on being vigilant. We will get there. It's just going to take some time, but things are hopefully in a good direction.
So I have a quick question for you, because I will say I always forget my mask. So I do the neck or like the scarves, so I can just pull it up and pull it down, and then I have multiple colors so it can match my outfit. But I'm a chick. That's what we do. But as soon as I leave a store, I tend to take it down to walk to my car. And partly too, right now, it's so hot outside. So when you're keeping this on, you feel like you can't breathe. Is it okay to wear it in a building and then take it down if you're outside walking to your car? Or should you keep it on the entire time? And also, I see a lot of people wearing them when they're in their car by themselves. Should they be doing that?
So I feel that personally wearing them outside is not as important as wearing them indoors when you're kind of in a closed space, breathing recycled air. There's surfaces that can, have that. I think once you get outside, as long as you're not in a crowd or standing in a line or anything where you have a little bit of social distancing, I feel that it'd be okay to take the mask off. I feel that people that are in cars that are wearing the mask, it's probably more than anything if they just forgot to take it down. They're so used to it at this point, which is kind of a good thing. I don't think it's necessary. Cars do have air filters in them, and unless you're in a car with other people, I personally don't think it's necessary to wear the mask in the car.
How many people do you think are wearing contaminated masks?
Oh, geez, I don't know.
I'm probably one of them.
What do you mean when you say contaminated?
Well, because we, like you're explaining how to take it on and how to take it off, and disposable ones, and so many times you just pull it up, pull it down, pull it up, pull it down. Well, if I now touch a surface and then I pull it up again, is that kind of defeating the purpose? Should you be changing it all the time or every time you touch a surface? I do try to use hand sanitizer constantly in between, but I'm still at times touching a mask and touching a surface.
Which is why you want to do a few things. You want to make sure that you're not touching the mask with your hands, of course. Try to adjust it from the ear straps, again, over the nose, under the chin, that kind of thing. The other thing is that if it's a cloth mask, you're regularly washing it with detergent. When you're not wearing the mask, you're not just throwing it on a countertop or hanging it from your rearview mirror, but more so you're putting it in a plastic bag so that it can stay, not contaminated. Frequent mask washing or changing it out if it's a disposable is going to reduce your chances. Now, if you touch a mask with a contaminated hand, your risk does go up, but it doesn't go up as much as if you were not wearing a mask at all. So I'm going to always encourage you to wear that mask.
Dr. Taweel, thank you very much for being with us today.
Thank you so much for having me, as always.
Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist with us on the Oakland County MegaCast.